Good afternoon, and thank you for joining us for another community briefing on COVID-19 and Lincoln's response. Joining me once again is interpreter Sharon Sinkler. Thank you, Sharon. And thank you to the media and all of our residents who are tuning in to these briefings. We want to remind everyone to visit our website, covid19.lincoln.ne.gov, to learn how you can protect yourself, your loved ones, and our community during this pandemic. We're going to begin with a situation update. At this time, Lincoln continues to have 8 lab-confirmed cases of COVID-19. 7 of those are travel-related, and 1 is community-acquired, or sometimes referred to as community spread. Again, the community-acquired case definition refers to an individual who has COVID-19, but who has no travel history and no identified contact exposure to the virus. So far in Lincoln-Lancaster County, we've had 325 negative tests and currently have 40 pending results in our public labs. The Lincoln-Lancaster County Health Department is also monitoring 96 individuals due to their travel history or exposures. As a state, Nebraska now has 172 cases and 3 deaths. By the end of day yesterday, Bryan Health had tested nearly 300 people for COVID-19 at its DriveThru testing sites over the last 7 days. And to access Bryan Health's LifePoint DriveThru testing, each person needs to make an appointment and have a doctor's order in order to be tested. CHI St. Elizabeth DriveThru testing site began operating today at North Star High School, and they are implementing similar procedures to qualify for testing. Our top priority here at the city in normal times, and of course throughout this pandemic, is to protect the health and safety of all of our residents. Today, we are going to focus our public health message on what to do if you develop symptoms of COVID-19 or are diagnosed with the disease. It's so important for people to have smart health and safety plans in place now in the event that they need them later. From the beginning of this public health emergency, we have stressed that those who are sick need to stay home to protect others. Fortunately, most people with COVID-19 do not experience life-threatening symptoms and are able to recover at home without medical care. If you are deemed safe by your medical provider to convalesce at home, we want to discuss important strategies for doing so in a way that protects you and others in your household and, of course, others in our community. The way that you and those in your household manage your recovery at home matters so much in this fight against COVID-19. Here are some important practices that will help keep others in your household safe and prevent COVID-19 from spreading outside your home. First, as much as possible, the sick person should stay away from others. This means that the sick person should stay in a specific separate room and use a separate bathroom if possible. Surfaces that are touched often should be cleaned once a day at least. The sick person should continue to be isolated until at least 24 hours after the fever is gone, without the use of fever-reducing medicines or after symptoms have improved. Again, the sick person should continue to be isolated until at least 24 hours after the fever is gone without the use of fever-reducing medicines or after symptoms have improved. Just as importantly, the family members or others who live with the sick person should also stay home to prevent the spread of the disease. This is true regardless of whether or not other members of the household are symptomatic. If you live in the same household as a sick person, stay home. Family members should contact their healthcare providers or the health department hotline for advice on their specific situations. That hotline number is 402-441-8006. This is just another example why it's so important for all of us to have 2 weeks worth of food and essential medicines on hand before anyone gets ill in our homes. Public health officials want you to stay home if someone in your household is sick. This is to prevent you from unknowingly spreading the virus to others. If you must go out of the house for essential reasons like medical care or to get groceries, limit contact with other people and try to keep at least 6 feet distance between you and others. But better yet, stay home. Moving on, we're going to talk a little more about changes in city operations. Our city departments continue to make changes to adjust to the current situation. StarTran has seen a dramatic decrease in ridership from about 12,000 customers a day to a few thousand. Ridership on March 26th reached an all-time low of 3,200 passengers. StarTran, as an organization, is taking several actions to respond. Starting this Thursday, StarTran will operate reduced service by operating a Saturday schedule from Monday through Saturday. Generally, this means buses will arrive at stops on the hour instead of the half an hour, and they will start running a little later in the morning and end a little earlier in the evening. You can find the schedule and all of the relevant information at startran.lincoln.ne.gov. Secondly, instead of boarding at the fare box next to the driver's seat through the front door, all customers who are able will board from the rear doors. This change will temporarily eliminate fare collection. Those who need to use a ramp or to have the bus lowered will continue to board using the front entry. We expect that ridership will continue to decline as more residents follow the social distancing recommendations to stay home and telework. At the same time, we understand that public transportation is essential for many to get to work or to take care of their basic needs, which is one reason why we're so pleased to announce a pilot transportation project that was already in the works prior to our public health emergency, but will be especially beneficial as we navigate life with important public health safety measures in place. In mid-April, StarTran is planning to launch an on-demand service pilot project. The pilot project will use vans to provide on-demand service. We are currently providing driver training and finalizing the operation details for that service, and we'll have more information in the days ahead. This project will help ensure that members of our community in need of public transportation still have access while we are operating on a Saturday schedule. And when this emergency is passed, it will provide additional access for handy van customers. LTU, Lincoln Transportation Utilities Director Liz Elliott, and StarTran Transit Manager Mike Davis are here to provide more details and answer any questions you might have.
Do we have any questions? Oh, yes. My name is Elizabeth Elliott, and I am the director for LTU. One of the big changes with this Saturday service is that the downtown trolley route will not be in service while we're in this reduced schedule. There's also Route 14 that will also not be running on the reduced schedule. As Mayor indicated, the other changes will be that the routes will now start at 6:40 a.m. and run with the last route at approximately 7:40 p.m., which is about 2 hours earlier than the 9:50 p.m. ending time that we normally run during the week. We hope that this will protect not only the public, but also our drivers, and also accommodate the reduction in the passengers that we are carrying. Any other questions? All right.
We can always come back to more questions at the end of the press conference if you have them about StarTran. Continuing on with changes in city operations, I want to talk a little bit about Aging Partners, another city agency that is adapting to the changes brought on by the COVID-19 public health emergency. Aging Partners serves over 10,000 seniors in our community, providing hot meals, health and fitness programs, and opportunities to socialize. They also serve Lincoln's lowest income and high medical need seniors through their waiver program. The agency works to enhance daily living and extend personal choices and educate the community in an effort to ensure the independence and full life of the people that they serve. And while the agency has closed its facilities temporarily and canceled its events during this public health emergency, many of the agency's important services continue. And today we are kicking off something new, the Sunshine Kids for Seniors project, to connect children with homebound seniors during the pandemic. The project encourages kids to create artwork that will be shared with older adults in a safe way. We know that our older adults are among those most at risk from COVID-19, and many are wisely following the advice of health professionals to stay at home and stay away from other people. But unfortunately, this physical isolation can leave our seniors feeling really lonely. And this project will use technology to safely connect children with our seniors to lift up their spirits and bring smiles to everyone involved. And our Aging Partners Director, Randy Jones, is here to tell us more of the details.
Thank you, Mayor. This population is one of the risk groups, and it's very important that they follow the guidance from the health department in terms of being isolated from others and spacing themselves for others. This is why, in addition to this new program, we're also really urging families, neighbors, and friends to check on seniors on a regular basis. This event will last for weeks, and this is the best way to possibly get those seniors the help that they need with perhaps grocery shopping or running an errand. It's real important that you reach out to those seniors that you know. We are open for service. Our number is 441-7070. And we have what we call first service coordinators at the end of that phone that can provide information referral and advice on many things, even beyond the COVID guidance. But with this program, very exciting. It's an intergenerational opportunity, and with that in mind, we're inviting youth and young adults to connect with older adults and help provide a smile during potentially lonely times. And that is called the Sunshine Kids for Seniors Project. The effort is intended to provide a way for kids to lift the spirits of seniors. Many seniors have been advised to voluntarily isolate themselves, and while many are making that choice themselves, this provides an opportunity for that intergenerational connection. To participate, youngsters and young adults can craft a note on a piece of 8.5 by 11 piece of paper. It can be colorful, a piece of art, or it can be a note of encouragement. And scan that piece of paper and email it to us. And we've created an email address for this project. It's called sunshinekids@lincoln.ne.gov. The artwork is picked up through the email. We print it off in color, and then we distribute it to those that are receiving home-delivered meals or to other housing facilities or other venues. We ask that the public not include personal contact information. If they do, we'll have to eliminate that artwork from being shared. But we do encourage the artists or the note writers to include their first name and perhaps their age. Again, I want to encourage the public to support our caregivers and to support seniors by checking on them regularly and letting us know at Aging Partners how we can help. Our number again is 441-7070. Thank you, Mayor.
Thank you, Randy. Finally, I just want to preview some of the topics we'll be discussing tomorrow in our briefing. And we know that when disaster strikes, there are some people who seek to take advantage of them through fraud and scams. So tomorrow's briefing, we will spend a little time talking about that and providing information and ways you can prevent yourself from becoming a victim. But in closing, I'd like to end on a happier note. Just recently this week, a poem by Ted Kooser, our former National Poet Laureate and our local treasure, was featured in the Lincoln Journal-Star in a column by Cindy Lang Kubik. And I wish to share it too. It is called Q. Some of us have known shortages, rationing long queues at fuel pumps, at trucks with safe water on pallets, or just empty pallets, those left by the road, torn pieces of plastic wrap flapping away. And although each of us one day runs short on the future, for all, there's the present we stand in, shifting our pains from one leg to the other, and always behind us, the past, having made it through everything, its hands on our shoulders, urging us on. Lincoln, I urge all of us to keep on going. During this extraordinary challenge, things will get worse, but then they will get better again. And on the other side of this pandemic, because we have fought hard and made sacrifices together, there will be the outstretched arms of our friends and neighbors, ready to encircle us once again in a loving embrace. We're happy to take your questions.
Riley Johnson, we're going to start with you.
Yes, hi, Riley.
Hi. First question, just some clarification for, I don't know if the health director's there, but did the emeritus case that was mentioned last week, did that result, the test results from that case ever reach the health department as to whether it's among the 8 cases confirmed?
It is not among the 8 lab-confirmed cases in the health department's records.
Great. Second question is for LTU or StarTran.
Hey, Riley.
Hi, Liz. Hi, Mike. My question is, first, with the change in operations, what sort of precedent is there for, or have there been previous times when StarTran has undertaken sort of an overhaul in its operations here with how you're boarding the bus, not paying fares, and the hours being changed?
Let Mike answer that on StarTran's history. However, I do know these are steps that are being taken across the nation. A lot of transit systems, both on the coast and also here in the Midwest, are taking very, very similar steps, such as the rear loading and the Saturday service. But with regards specifically to StarTran, I will let Mike answer that. He'll have better information.
To my knowledge, we have not had anything like this in the past, probably 10 years that I'm aware of. So we've had some fare reductions, but never avoiding the fare box, never entering through the rear door. Rear door entry probably wouldn't have been possible in the past due to the different type of buses that we've had in the past, but we can do that today. And I don't think as far as a change from Saturday service, I also don't think there's a precedence, other than we used to, the Saturday routes for the most part are the same on weekdays as they are on Saturdays. With the last transit development plan, we made those consistent, so that should be an easier transition than it might have been in the past.
And a follow-up to that, what's the interplay between these changes for StarTran, the pilot project, and the handy van service that's being offered? Does anything with regard to the handy van service change with the sort of fixed route schedules?
There are slight changes to the handy van schedule. They will now be operating 5:30 a.m. to 8:30 p.m. Monday through Friday, and then they will go to their Saturday schedule, which is 6:30 to 6:30, so 6:30 a.m. to 6:30 p.m. on Saturdays. We also will not be collecting fare for the handy van rides as well.
Talk a little bit more about the aim of the pilot project, how how it was conceived, and then how it plays into this sort of pandemic environment, and what the benefits might that are being explored are.
Yes.
This was a program that we were going to roll out originally, maybe just not quite as soon. This does allow for individuals to schedule their rides on the same day and basically minutes before. Much like an Uber service, they would be able to go to an app. They would be able to schedule a ride. They can track the ride as the van as it comes to them. It gives them an estimated arrival time, and they would put in their destination. And so it operates much the same as Uber or Lyft in that sense. I think the original intent was to start off with just handy van. However, with this pandemic, we are rolling it out to try and fill in the gaps, because we do realize that this reduced bus service will be cause some difficulties and challenges for some of the public still trying to get to and from work in those early hours of the day or later in the evening. So this could also be used to fill in those gaps when the fixed route services are not running.
Lastly, I don't know if I'm the only reporter on here, but I might as well ask my question. What efforts to sort of ensure social distancing on buses have been undertaken in the last couple of weeks? And is there any, or have there been any sort of increased disinfection of the cabins?
That's a great question, and I'm going to start first. The cleaning schedule, we do clean the buses. We have increased that, especially in the handy van services, where when those vans are empty, we are taking that opportunity to wipe them down and make sure that those are clean. In addition to our cleaning schedule and routines on the buses, we have actually posted every other seat kind of staggered to make sure that the passengers are separating. So we are limiting the seats that people can sit in by posting signs that that seat's not available, forcing the separation. Also on some of our busier routes, at the time, Kawasaki was a big one, where we were doubling up our buses to try and meet the 10-person limit. So we would have 2 buses running together, and once the first bus had 9 passengers, the remaining passengers would get into the other bus behind it. And that was really helping us maintain that 10-person recommendation, even on those busier routes.
And will that double bus approach continue on the new schedule?
We will assess that on a daily basis. Right now, our ridership has gotten so low, and with a lot of the businesses closing, we anticipate that won't be an issue. However, if it is an issue, our plan is to double up on those routes. But we will monitor it daily and see how the number of passengers varies day to day, especially with the services now running hourly instead of half hour on some of those routes.
Thank you.
Any other questions for Randy or myself? Okay, well, we really would appreciate if kids want to go and submit their artwork and notes to connect with seniors who may be feeling lonely during this time of isolation. And again, the website for that is?
It's an email address, sunshinekids
sunshinekids
at
lincoln.ne.gov. Kids can email their PDF copies of their art to that address, and we would be so happy to put them to good use. Thank you again.